Perinatal Pelvic Health Service is there for pelvic health advice, knowledge and treatment during pregnancy and for up to a year after birth. This is known as the perinatal period. So if you are pregnant or just had a baby, this service can support you. Within the North East and North Cumbria, we are improving access to specialist teams, including midwives, physiotherapists and gynecologists who will work together to offer this service and give you more support with pelvic health problems during and after pregnancy. This will include a website with information about available support, resources to help you and a self-referral option. Each trust within the North East and North Cumbria has their own service and may operate slightly differently, but all the trusts within the region are working together to provide you with the best information and to standardise the care you receive. This service is for people who are pregnant or have had a baby in the last 12 months and are experiencing problems such as leaking wee when laughing or sneezing. This was often seen as normal after giving birth. However, leakage of wee, poo or wind is common, it is not normal. Issues related to poor pelvic health that you should look out for, such as leakage of wee or poo, prolapse, pelvic pain, pregnancy back and pelvic pain, bladder and bowel emptying issues, and problems with sex related to birth. During your midwife appointment, you will be asked about your current pelvic health. Your midwife may then direct you to some self-help advice, or if required, you will be referred directly to the Perinatal Pelvic Health Service to see a specialist pelvic health physiotherapist. You can also refer yourself to the service via the Trust's Perinatal Pelvic Health page, which you can access on the local Maternity and Neonatal Systems webpage.
I'm Heather. I've given birth to 3 children and I've had a few issues with my pelvic health. I've had pelvic girdle pain, which is sort of pain around the pelvic area, and it makes it quite difficult to walk. After all of my pregnancies, I've had worsening issues with incontinence, which is leaking wee. The first time around, I didn't really know what to expect. Through the pregnancy, I was fine, but it was after the pregnancy, a few months later, that I noticed that I was having problems with leaking of wee. I wasn't able to, hold it when I was going to the toilet. I was finding that I was becoming damp regularly. So I got pregnant again, and that got worse during my second pregnancy. And then in my third pregnancy, my latest pregnancy, I also got pelvic girdle pain, which is a condition where it makes it really uncomfortable, for me at least, it made it really uncomfortable to walk. I have pain in my hips and sort of around my pelvic area. And I'm usually a really active person. I like to be out and about, cycling and walking and all sorts of things, and I found it really depressing that I couldn't do those things and I couldn't walk as far as I wanted to. I really struggled when my eldest started school and I was heavily pregnant. I struggled to walk him to school, which is something I really wanted to do. After that, and that was a few years ago now, I've still continued having problems, not with the pelvic girdle pain, that did go away, but I've had problems still with the leaking and the incontinence. Once you have children, it's very difficult to put yourself first. If I'd felt like my symptoms were very serious, I'd have had the rationale of going, I'm looking after myself so I can look after the children. But because I could function, because I could get by on a day-to-day basis, because there were measures I could take to manage the symptoms, it didn't really cross my mind to seek help. There's this whole thing, in society where it's just expected that that's what happens after you have a baby. That, oh well, you just wet yourself. There's all the ads, everyone sees ads on the telly, don't they, about for the pads and the products that can help with the symptoms. And I guess that sort of normalises it in a way that I don't think is helpful. That makes it seem like that it's something that there's nothing can be done about it, and just buy our products forever and that'll be fine, like that's what can be done. It's difficult, isn't it? Because on the one hand, there's a, oh, it's just what happens after pregnancy, get on with it. And at the same time, the position I was in, going, it won't happen to me because X, Y, Z. And I do think we just need to be talking about it more. Women need to talk about it more, and to know that it's not actually anything to be embarrassed about. It happens to so many people at all stages of life, but particularly around and about pregnancy. But it's not something that you just have to put up with. To anyone who's experiencing issues, I would say you're definitely not the only person that you know who is having the issues. If you talk to probably 5 of your female friends, you will find that somebody, particularly if they've had children recently or at any point, will have experienced or still be experiencing some of these pelvic health issues. It's really common, but it shouldn't be seen as normal. You don't have to just live with it, and you can make a change.
It is recognised that at least 1 in 4 people experience pelvic or back pain during pregnancy. Up to 1 in 2 people will experience symptoms of pelvic health problems. We understand that these symptoms can affect your daily life and can sometimes be difficult to talk about, but we are here to offer support and help. You don't have to put up with this. Many others have improved their symptoms and got back to doing what they really enjoy. Having good pelvic health is important to allow you to enjoy your life and normal activities during and after pregnancy. For additional support, please visit northernlms.org or speak to your midwife, GP or health visitor. You can also visit Know Your Flows.